Cancer doesn't always knock on the door with a loud warning, especially in older women. Sometimes it whispers through subtle changes that are easy to overlook or dismiss as part of normal aging. But knowing what to watch for can make all the difference. Today we're shedding light on 6 unexpected signs of cancer in senior women, clues that may seem minor, but could be your body's way of asking for attention. 1. Persistent fatigue that doesn't go away. Fatigue is something we all feel from time to time, especially as we grow older. A long day of errands, a night of poor sleep, or even emotional stress can leave you drained. But when that tiredness becomes constant, when you wake up already exhausted or find yourself too tired to enjoy your usual activities for weeks on end, it's time to pause and pay closer attention. In senior women, persistent fatigue can easily be brushed off as just getting older. And that's exactly why it's one of the most overlooked signs of cancer. Unlike ordinary tiredness, this kind of fatigue doesn't go away with rest. It lingers. It settles into your muscles, your thoughts, your routines. You might find it harder to walk upstairs, prepare meals, or concentrate on reading. Even simple pleasures like chatting with a friend or tending the garden can feel overwhelming. What makes this kind of fatigue especially concerning is how it often shows up early in several types of cancer. It could be one of the first signs of leukemia, colon cancer, or even ovarian cancer. The reason? Cancer cells use up the body's energy supply and release substances that alter the way your body produces and uses energy. In some cases, cancer can also lead to internal bleeding or anemia, both of which drain your energy silently. But here's the challenge: fatigue in later life is common. That's why context matters. If your tiredness is new, worsening, or simply doesn't respond to the usual fixes, like more sleep, better food, or less stress, it's time to talk to your doctor. Fatigue alone doesn't mean you have cancer. But when it lingers, it deserves attention. This type of tiredness often partners with other quiet changes. You might notice pale skin, shortness of breath, or even dizziness. These symptoms can be tied to low iron levels, internal blood loss, or suppressed immune system, all potential clues pointing to an underlying condition. It's also important to remember that persistent fatigue is not just a medical issue, it's an emotional one too. It chips away at your independence, your confidence, and your connection to the world. And when others don't understand why you're so tired all the time, it can feel lonely. So if you find yourself saying, "I just don't have the energy I used to," and that feeling sticks around no matter what you do, don't ignore it. Fatigue is your body's way of speaking to you. It's not whining. It's not weakness. It's a signal. Bring it up with your healthcare provider. Don't let anyone dismiss it as just part of aging. You know your body better than anyone else, and when something feels off, it's worth a second look. Cancer caught early is often treatable. And sometimes all it takes is noticing that the exhaustion you're feeling isn't normal. It's not about panicking, it's about paying attention. 2. Unexpected weight loss without trying. For many women over 60, gradual weight gain is a familiar companion. So when the scale suddenly shifts in the other direction, when clothes start to hang loosely and you haven't changed your eating or exercise habits, it might seem like a pleasant surprise. You might even think, well, maybe I'm just finally shedding those stubborn pounds. But unexplained weight loss, especially in senior women, is one of the most overlooked warning signs of a deeper health issue, and in some cases, cancer. Now let's be clear, not all weight loss is alarming. If you've been trying to make healthy changes, eating better, walking more, or reducing portion sizes, then a gradual drop in weight is expected and often welcome. But when weight loss happens out of the blue, without any intentional effort, and especially if it's more than 5 or 10 pounds in a short span of time, it's time to pause and ask why. Weight loss that seems to come out of nowhere can be an early sign of cancers such as pancreatic, stomach, esophageal, or lung cancer. These types often interfere with how your body absorbs nutrients or changes the way your metabolism functions. You might be eating the same amount of food or even more and still losing weight. That's because some cancer cells release substances that increase your body's calorie burning, almost like your body is revving its engine all the time, even when you're resting. In other cases, tumors in the digestive tract may affect your appetite or your ability to eat comfortably. Maybe you feel full after just a few bites, or you've started avoiding food because of nausea, indigestion, or vague discomfort in your stomach. You might chalk it up to stress, an aging gut, or even a sensitive stomach, but these subtle changes in your relationship with food can be signals worth exploring. Sometimes the signs aren't even about food at all. You might notice your face looks thinner, your rings are looser, or your watch no longer fits snugly. Friends might say, "Have you lost weight?" with a surprised look on their faces. And while compliments may feel nice at first, deep down you know you didn't try to lose the weight, and that's the red flag. The emotional side of weight loss also carries weight, no pun intended. For many senior women, food is more than nutrition, it's comfort, tradition, and connection. A sudden disinterest in meals or a shift in how your body reacts to familiar foods can also affect your mood and social life. You might skip dinner with friends because eating no longer feels enjoyable. You might cook less, snack more, or feel like mealtimes are a chore. These quiet lifestyle shifts, when combined with physical changes, are worth noticing. And here's something important. This kind of weight loss doesn't always come with pain. That's why it's so easy to overlook. You might feel generally fine, just lighter. But when your body begins to shrink without a clear cause, it's often your internal systems trying to alert you to something deeper. So what should you do? Start by tracking your weight, even casually. If you notice more than 5% of your body weight lost over a few months without trying, that's a key indicator your doctor should know about. Keep a simple food journal too. Write down what you're eating, how much, and how you feel afterward. These notes can offer powerful clues that help your doctor understand what might be going on inside. Bring up your concerns, even if they feel minor. Say something like, "I've lost weight and I'm not sure why." That simple sentence can lead to tests that might catch something early, something that, if ignored, could grow into a much bigger issue. And if you're feeling uncertain or afraid, know this: concern is not the same as panic. Paying attention to your body is a form of respect. It's not about living in fear, it's about living with awareness. Your body, after all, has carried you through a lifetime of moments. It deserves to be heard when it whispers, not just when it shouts. 3. Bloating or changes in the belly that don't go away. We've all felt bloated at some point, after a big meal, during certain times of the month, or after eating foods that don't sit quite right. Bloating in itself isn't unusual. But when it becomes a regular occurrence, especially when it doesn't seem tied to food or digestion, and when it's accompanied by a feeling of fullness or discomfort in the lower abdomen, it could be a sign of something more serious. For senior women, persistent bloating is often dismissed as part of aging or assumed to be harmless indigestion. But this is exactly why it's important to pay close attention. Ongoing bloating, especially when it's new, uncomfortable, or makes your clothes fit differently, can be an early warning sign of ovarian cancer. Ovarian cancer is sometimes called the silent killer because its early symptoms are vague and easily mistaken for less serious conditions. Bloating is one of those subtle clues. It might feel like your stomach is swollen or stretched. You may have difficulty buttoning your pants, even though you haven't gained weight. You might feel full quickly after eating just a small amount. These are quiet, gradual changes, but they are not meaningless. Here's where it gets tricky. Many digestive issues cause similar symptoms. Constipation, irritable bowel syndrome, or gas can all create bloating. But the difference is in the duration and frequency. If the bloating comes and goes and is clearly tied to what you eat or drink, it's likely nothing to worry about. But if it's happening every day, lasting for weeks, or getting worse over time, especially if it's paired with pelvic discomfort or urinary urgency, it's time to check in with your doctor. Think about this. Your abdomen is one of the most sensitive areas of your body when something internal is off. It's where your reproductive organs, digestive tract, and urinary system all live in close quarters. When something isn't right, whether it's inflammation, a mass, or fluid buildup, your belly will often be the first place to speak up. You might notice subtle changes at first. You may go up a pant size without gaining weight. You may feel an odd pressure in your lower belly or a sense of being puffed up all the time. You might pass it off as normal aging or a side effect of medications. But when that sensation doesn't leave, when the discomfort becomes your new normal, it's time to listen. And it's not just about physical discomfort. Chronic bloating can affect your mood, appetite, sleep, and overall well-being. You may find yourself avoiding meals, social outings, or physical activity. Over time, this shift in your daily life can create isolation or anxiety. That's why identifying the cause early matters, not just for your physical health, but for your emotional vitality too. So, what should you do if you're experiencing this? First, track your symptoms. Make note of when the bloating occurs, what you've eaten, how long it lasts, and whether it's tied to your menstrual history, even postmenopausal. Write down any accompanying symptoms like pelvic pain, changes in bathroom habits, or lower back aches. This will help your doctor see the full picture. Next, speak up. Say something like, "I've been feeling unusually bloated for a few weeks and it's not going away." Be clear and firm. Persistent bloating, even if it seems minor, is not something to ignore. Your doctor may recommend a pelvic exam, an ultrasound, or a blood test like the CA-125, which is often used to detect ovarian cancer. The key is this: bloating that lasts more than 2 weeks and doesn't respond to dietary changes is not normal. It may be nothing serious, but it also might be your body trying to tell you something vital. Don't downplay it. You have every right to feel heard, to ask questions, and to investigate what your body is trying to communicate. Early detection can make all the difference, not just in treatment options, but in peace of mind. 4. Changes in bathroom habits, especially bowel or bladder patterns. As we get older, it's common to experience changes in how our body works, including in areas we might be less comfortable talking about. The truth is, many senior women notice shifts in their bathroom habits over time. You might need to urinate more frequently, or you may find yourself constipated more often than before. These changes are easy to chalk up to aging, dietary habits, or even medication side effects. But what happens when those changes don't improve, or when they come on suddenly without a clear explanation? Changes in bowel or bladder habits, especially if they persist for more than a few weeks, can be early warning signs of certain cancers, including colon, rectal, bladder, or even ovarian cancer. And because these symptoms can be subtle, they often go unnoticed or unreported until the disease has progressed. Let's talk about what to look for. If you're suddenly going to the bathroom more frequently, or experiencing a strong sense of urgency that wasn't there before, especially during the night, it could be a signal that something's pressing on the bladder. In some cases, this is caused by a tumor near the urinary tract or pelvic region. Other women notice the opposite. They might find that their bladder doesn't empty fully, or that it takes longer than usual to start the flow of urine. There may be discomfort, a burning sensation, or even small amounts of blood in the urine. These symptoms could indicate a urinary tract infection, but they could also be signs of something more serious, like bladder cancer. Now let's turn to bowel habits. Constipation is common among older adults, especially when there's not enough fiber, water, or movement in daily routines. But if you've had regular bowel movements for years and suddenly you're struggling to go, or going far more often than usual, it's worth paying attention. You might notice stools that are thinner than usual, or feel that you're not fully emptying your bowels even after using the toilet. You may see blood in the stool, which can appear bright red or dark and tar-like. These can be signs of colorectal cancer. In fact, subtle shifts in stool shape, frequency, or consistency are often the body's first clue that something is off. Another symptom to watch for is pain or cramping in the lower abdomen that seems to come and go without a clear cause. If this happens alongside changes in bowel habits, it's a signal worth investigating. Of course, not every change points to cancer. Diet, medications, hydration levels, and conditions like irritable bowel syndrome can all influence how your body behaves. But the key difference is duration and intensity. If these changes are new, last for more than a couple of weeks, or are getting worse instead of better, they should not be ignored. Let's not forget that women are often conditioned to minimize their discomfort, to put their needs second, or to dismiss changes in their own health. You might think this is probably nothing or it's just part of getting older. But those instincts, while understandable, can delay critical early detection. What can you do? Start by being observant. Keep track of any changes in your urinary or bowel habits. Make a simple journal with notes about how often you're going, whether there's pain, blood, or discomfort, and how long it's been happening. This information gives your doctor something concrete to work with. When you see your physician, be direct. Say something like, "I've noticed changes in how often I use the bathroom and it doesn't feel normal." You don't have to explain every detail right away. Just opening the door to the conversation is often enough to prompt the right tests and follow-ups. Remember, your body is always talking to you. Subtle changes, especially the ones that disrupt your routines or make you feel uncertain, are worth listening to. There's no shame in asking questions or seeking answers, especially when it comes to protecting your health and peace of mind. 5. Unexplained pain, especially when it's subtle, persistent, or dull. Pain is a complicated companion in later life. We expect it to show up here and there: a sore back after gardening, a stiff knee when the weather changes, or a little ache in the shoulder from sleeping the wrong way. And most of the time, these everyday pains have a clear cause and go away on their own or respond well to rest, stretching, or over-the-counter medication. But what about the pain that lingers? The ache that doesn't shout but whispers quietly day after day? The discomfort you can't quite place but you know it's there? In older women, persistent, unexplained pain can be one of the earliest and most overlooked signs of cancer. This is because cancer, especially in its early stages, doesn't always cause sharp or severe pain. It often starts subtly: a dull ache in the lower back, a twinge in the pelvis, or a pressure in the chest that comes and goes. It may not interfere with your daily life at first, but it stays. It nags. It reminds you it's there when you're walking, sitting, or trying to fall asleep. For example, ovarian or uterine cancer can cause vague pelvic or lower abdominal discomfort, feelings that might be mistaken for constipation, menstrual-like cramps, even post-menopause, or just aging muscles. Similarly, bone cancer can begin with a dull ache that feels no different than arthritis or old injuries. In the case of pancreatic cancer, people often report a gnawing pain in the upper abdomen that radiates to the back. These signs are subtle, persistent, and easy to ignore until they're not. What makes these types of pain especially dangerous is their familiarity. You might tell yourself it's just part of getting older, or I must have pulled something, or even I don't want to be a bother. But your body knows the difference between occasional soreness and something that doesn't feel quite right. The key is to listen. Here's a gentle guideline. Any new pain that lasts more than 2 weeks and doesn't improve with typical remedies deserves a closer look. Pain that wakes you from sleep, pain that seems to be growing stronger over time, or pain that doesn't respond to heat, ice, or movement is not normal aging, it's a message. And pain isn't always physical. It can affect your energy, mood, and relationships. When you're living with discomfort every day, even if it's mild, it can chip away at your joy. You may cancel plans, sleep poorly, or feel more irritable. It changes how you show up in the world, often without you realizing it. This is why it's so important not to brush off the signs. Your body isn't trying to scare you, it's trying to protect you. Pain is its language, and when it speaks consistently, it means something is wrong. So what should you do? First, don't wait. Keep a simple log of the pain. Write down when it started, where you feel it, how often it shows up, and what makes it better or worse. This journal becomes a powerful tool when you visit your doctor, helping them see patterns that might not be obvious in a quick conversation. Then be honest when you talk to your healthcare provider. You don't need to diagnose yourself, you just need to say, "There's a pain that's been bothering me, and it's not going away." That one sentence could open the door to early testing, a proper diagnosis, and if needed, life-saving treatment. And here's one more thing: advocate for yourself. If your concerns are brushed aside, or if you feel dismissed, it's okay to ask for a second opinion. You are not overreacting. You are not imagining things. You are being wise, alert, and proactive, and that can make all the difference. Pain is not a punishment. It's not weakness. It's your body trying to guide you toward healing. Have you ever noticed a small change in your body that turned out to be something bigger? What advice would you give to others who might be going through something similar? Write your opinion in the comments. We are always interested in reading them. If this video helped you understand your body's quiet messages a little more clearly, please consider subscribing to our channel and liking this video. Your support helps us keep creating thoughtful, empowering content just for you.